There is a GP shortage in Australia. It's caused by a couple of major factors. One is fewer medical students when they graduate choosing to go down the GP pathway, but particularly in the regions, it's because we usually rely on a lot of migrant doctors who haven't been coming during COVID. Labor has been talking about this in particular in opposition. In government, it says it will address this. So how will it do so? Joining me live is Assistant Minister for Rural and Regional Health, Emma McBride. Thanks very much for your time. You've been meeting with a lot of local community groups, including GPs themselves. What are they saying is needed to address this shortage, and how bad is it?
This is a problem that is apparent across Australia. I've been meeting with local communities, Launceston in Tasmania, Townsville in far north Queensland. I'm here in Mildura in Victoria today. And what I'm hearing is it's never been harder or more expensive to see a doctor. And this isn't something that's just happened. This is a result of the almost decade of neglect of the former government. And it's something that, as the Assistant Minister for Rural and Regional Health, that I'm determined, working with GPs, working with nurse practitioners, working with allied health workers to turn around. It can't be that someone living in the most rural part of Australia has a 19-year less life expectancy than someone living in a metro. And this is something that is a widespread problem. It starts in the outer suburbs and continues across regional and is felt most acutely in rural Australia.
One core demand from GPs of all stripes, it seems, and doctors' groups is the Medicare rebate per appointment. That's fallen as a percentage over quite a number of years now. It was frozen, but the point is the percent that is rebated has dropped again and again and again. Is that why bulk billing in particular, and even the GP numbers out there, has dropped? Do you agree with that as a basic premise?
There are lots of contributing factors to the GP shortage. And as I mentioned, this has happened over a decade of the former government. Minister Butler, the health minister, stood up the Strengthening Medicare Task Force not long after the election, because this is one of the top priorities of our government. And those recommendations from the Strengthening Medicare Task Force are going through the budget process and will be backed in by our $750 million Strengthening Medicare Fund. There are many contributing factors, and we need a coordinated and well thought out response to be able to make a genuine change to the health outcomes of people living in rural and regional Australia.
Right, and so what you're saying is one thing won't fix this issue, but money's a pretty important one, whether we like it or not. So do you agree that there is a basic core issue here, that rebate, the fact it's been going down in real terms, is a key factor to the issue we're seeing in terms of GP shortages, and not just GP shortages, but bulk billing falling off as well?
Well, the Medicare rebate freeze that we saw under the former government has, yes, contributed to this problem. And it's one of the considerations of the Strengthening Medicare Task Force. And those recommendations are going through the budget process at the moment, and they will be backed in by the $750 million Strengthening Medicare Fund. But what I've heard around Australia is that there are lots of different solutions to these healthcare access and affordability problems that people see. Today in Mildura, I've heard from the local Murray PHN who are talking about nurse practitioners and the vital role and the expanded scope of practice that they can play. So there's lots of different solutions that we need to consider, but in a well-coordinated, integrated and thought-out response.